some health inequalities the virus has exposed. Alice Bandukravi can tell us more.
I hate needles.
Dr. Nwaogwugwu is a GP based in Lambeth who recently got the COVID vaccine.
I had the vaccine today. In Lambeth, where I work, there's a big long queue of, to put it bluntly, white people, hardly any black people, and now there's concerns that the black community that people are most concerned about are not actually going to get the vaccine.
She made this video for her friends and family to dispel some of their reservations about getting the jab.
We knew as family, as friends, as I guess black doctors maybe, that 3 or 4 months ago, our communities were not going to take this vaccine because there's a lot of mistrust. Now, as the vaccine is rolling out and we're coming home and we're speaking to friends and family in our different church groups, we're realising that actually maybe we are 1 or 2 in 100, and I don't think we're exaggerating, that are maybe going to actually going to have the vaccine.
Other GPs in London are concerned too.
I've not seen as many people of African descent, and that concerns me from a personal level. I'm in North London, so whether the population is less up here, but yeah, it's a concern, and I think there's a lot of work that we doctors of African descent have to do to continue to educate and have conversations with our community about the importance of accepting the call for the vaccination.
It's far from clear why exactly some communities are reticent, but there are some cultural factors at play, according to doctors working on increasing the take-up of the COVID vaccine.
There's lots of mistrust from things that have happened in the past, and so there's lots of spiritual and cultural conversations that people are still thinking about herbal remedies, and that could cure almost anything. Well, that's probably taken to a bit far, and that also brings in the Christianity or religious aspects of things. Whereas some people, they're not exactly sure, they might be a bit skeptical, but then they take on the notions of their religious leaders. Maybe the religious leaders have decided the vaccine is not a great thing. And this is not universal, but I've seen this happen as well.
As so often with COVID, a lot more work still has to be done to improve vaccine take-up amongst people of colour. But the stakes couldn't be higher, particularly for those whose communities have been so badly affected. Alice Bandukravi, BBC London.
A roundup now of some of the days